We had two people come in with questions about nightmares recently, one from Colorado, another as far away as Malaysia, and both asked a very similar question where they were talking about the new onset of disturbing dreams. Some of the dreams were violent and brutal. Clearly they were very disturbing, but the key feature was that they were new in onset. One particular patient mentioned that they'd only been having them for 2 weeks. This is a topic that is not rarely discussed because, first of all, the literature on nightmare treatment almost always is working with individuals that have chronic nightmares. And acute nightmares within the first couple of weeks or couple of months is something less common that a doctor would even, or a therapist would even hear about. So when you have a situation like that, the question immediately arises is, what is going on? Why does someone suddenly start having nightmares? Now, in terms of a psychological explanation, we would think the most likely thing is that prior to the 2-week experience of the nightmares, the individual is having some type of stressful, emotional experience, either in their daily life on a regular basis, or something that actually happened a month or two ago that was, if not traumatizing to them, it was very, very intense in ways that made it, very memorable and has been weighing on their mind a great deal. So that's the most likely explanation, but I just want to caution you that the new onset of nightmares is not a regularly occurring phenomena, and there are actual medical reasons. For example, some people, it is a sign that their blood sugar is dropping in the middle of the night. So for example, a diabetic who was taking medication and they were using too much medication and the blood sugar level dropped could suddenly start having nightmares. There's also other medications that trigger the side effect of nightmares, such as beta blockers, again used in hypertension or heart disease. So the concept of new onset nightmares is actually a little bit more distressing and creates a little bit more curiosity in the mind of the therapist or the doctor, because if we don't have an obvious explanation, it might be well worth looking into other medical or psychiatric explanations.